All right, you just saw a few moments ago Jared Kushner saying there is no collusion going on, but is there a big old distraction going on? Because every reporter out there focusing on what he had to say or not say is one less minute devoted to things like the budget, things like tax cuts, things like health care rework, all of which probably concerns my next guest, the White House Budget Director, Mick Mulvaney, who joins me right now. Director Mulvaney, very good to have you. Thank you.
Neil, good afternoon. Thanks again, as always, for having me.
Do you worry, whatever your opinions on this whole Russia thing, that it drags on and on and on and nothing else gets done?
I don't worry about it too much. I get frustrated along with a lot of other folks who are so focused on policy that it gets all of the attention that it does, but it doesn't stop us from doing our work. Believe me, in the building across the street here at OMB, we're working 7 days a week on policy. We don't spend any time on Russia because that's not what we do, and we hope that sooner or later folks will actually start paying attention to what we're doing, because there's some neat stuff happening within this administration.
I don't know how closely you follow the markets. Obviously, you're pretty astute following them, but you know that they have run up fast ever since the president's election and since the inauguration. And if any of this is concerning them, these latest dramatic developments or lack of dramatic developments, just political developments, they have a funny way of showing. The NASDAQ, for example, as you might be aware, is at a record right now. So what do the markets bet on, you think? When they talk to me, or a lot of the principals talk to me, Director, they assume they're going to get tax reform. They're going to see it this year, are they?
They are. I also think they're going to get health care reform. I think some of the challenges you're seeing in the Senate mimic some of the challenges we saw back in March in the House. There was a time in, I think, mid-March where a lot of folks said that health care was dead, it would never get out of the House, and a couple weeks later it did. Seeing a lot of those same dynamics in the Senate right now, and I think ultimately a health care package will pass out of the Senate, will pass the House, will be signed by the president.
When do you think it will be?
You know, I actually think they have to do something before September. As a former elected official, I really wouldn't want to go home without having followed through on my biggest promise. What do you tell people, even if somebody else is the person who killed it, how do you defend your party as a Republican by saying, well, thanks for giving us the House, the Senate, and the White House, but we didn't actually follow through on our biggest promise? I think that weighs very heavily on many of my Senate friends, and it should, and that's why I think you'll see health care. Then I do think you'll see tax reform shortly thereafter.
You know, as a former founding member, actually, director of the Freedom Caucus, this largely conservative group of conservatives who aren't keen on you know, more spending or even keeping tax hikes in effect, they seem to be open to this Senate measure, that the one that didn't seem to be going anywhere, that would include the taxes on the upper income for you know, the Medicare and related expenses. Now, how did you feel about that? How would you feel if a final draft of something that comes out of the Senate includes keeping taxes like that in there?
Sure, a couple different responses to that. At one hand, politics is the art of the possible, and if that's what it takes to get Obamacare repealed, that certainly wouldn't bother me if I put my old Freedom Caucus hat on. I think a lot of my friends in the House feel the same way. But I also add to that the fact that tax reform is coming next. We know that it is. It may be a second bite at the apple to try and fix different parts of the tax code. So it doesn't at all surprise me that that hasn't killed the bill in the Senate, or at least it doesn't look like it's killing the bill in the Senate. And I do encourage the Senate to go ahead. If that's what they think it takes to get rid of Obamacare on that side of the building, they should go ahead and press on with that, and we'll deal with taxes next in the next chance we get.
But you could live with that yourself as the budget director.
Again, as the budget director, as a member of Congress, what am I, former member of Congress, what am I interested in? Getting rid of Obamacare, because I think more than anybody else, we get down in the weeds over here and we see what the existence of Obamacare is doing to people. There's so much talk about, oh, how many people will or won't be covered, when what we see every single day is people back home every single day actually losing their coverage right now in the real world under Obamacare. So getting rid of that has to be the highest priority.
Now, as you know, that is the focus with any of these reworks on the Affordable Care Act, as you know, sir, that the CBO says more people end up not having health care than would be the case if they stuck with Obamacare as it is, and it prompted you to criticize the way the CBO arrives at that data, to which 8 former CBO directors, as you know, have criticized you for criticizing them.
Sure.
Where does this stand?
Look, the CBO has been wrong. They're challenged with a very, very difficult burden, right? They're supposed to sort of anticipate what a $20 trillion national economy is going to do. They're supposed to challenge with the methodology and how they're supposed to measure a particular piece of legislation.
Right.
Extraordinarily difficult. Does not undo the fact, however, they're still using Jonathan Gruber's methodology to look at health care bills. So the methodology that was designed to get Obamacare to pass in the first place is now being used to critique the bills designed to replace Obamacare.
Jonathan Gruber is essentially the man who created Obamacare and talked about the mandate and that metric used to just keep people on insurance.
And about
now,
lying to the American people
mandate,
in order to get it passed.
Is it a given then, and do you tell your colleagues, Republicans in particular, look, you remove the mandate, this is what's going to happen, and you ought to be able to explain why it happens, because they're afraid of it?
Sure, they're afraid of it because, you know, the CBO is often touted by folks who oppose a bill as this nonpartisan entity, and they are certainly nonpartisan, but the methodologies certainly have their weaknesses. The short answer on coverage, for example, is that the CBO assumes that if you are on Medicaid right now, when the federal mandate exists, that you will choose to go off Medicaid once the mandate is gone. I want you to think about that for a second, Neil. What the methodology they're using says is that you will choose to be uncovered rather than take a free government program. That's just absurd, and I think it sort of exposes the weaknesses in the CBO system for what they are.
Whatever the rationale behind the fear of these numbers when they come out, sir, I'm reminded of Newt Gingrich just recently saying, you know what, the better part of valor might be, I'm paraphrasing here, Director, proceed to tax cuts, you know, move over this whole push for Obamacare repeal, because time's a wasting. What do you make of it?
We need it all. We introduced the concept 2 weeks ago of Maganomics, Make America Great Economics, and it was sort of this uniting theme on how we get to the one thing that this administration is pushing for every single day, and that's 3% economic growth sustained, back to the old normal, a healthy American economy. Yes, we need tax reform to do that, but we also need Obamacare to go away in order to do that. Obamacare and several left-leaning think tanks say the same thing, creates a disincentive to work.
So built into that
GDP.
3% growth, and the reason why you want to see this health care thing is getting the health care thing reformed, then the tax cuts. You can't get there with one or just the other.
Yeah, and a big part about it, and I don't know if we get a chance to talk about it today. I hope we can come back another time and talk about the deregulatory efforts that we've been through. I think it's the second most important thing the administration has done in the first 6 months. Certainly Neil Gorsuch is the highlight, but we've delayed or stopped over 860 regulatory actions in just the first 6 months of being here. That's what I think you're seeing driving a lot of the optimism in the economy, what's driving a lot of the markets. Folks know, who pay attention, folks know what we're doing in this administration on the dereg front, and I think it's a big part of getting us to 3%.